It's estimated the condition ME affects more than 400,000 people in the UK, yet for decades, many of them have felt invisible within the healthcare system. With a new UK government plan now on the table for NHS England, promising better care and more research, some are a bit more hopeful, but others say it's too little, too late. So, are we still failing people with ME? Let's talk about this first this morning with Dr. Charles Shepherd, who's Honorary Medical Adviser and Trustee at the ME Association. Charles, thanks so much for your time this morning. Good morning.
Good morning, Stephen.
What is ME?
Right, so ME stands for, in medical language, myalgic encephalomyelitis. In short, it's a very debilitating and it's often a long-term medical condition that involves the muscles, the brain, and the body's immune system, hence this name, myalgic encephalomyelitis. As you said, and this is new research from Professor Chris Ponting's unit in the University of Edinburgh, the current figures suggest that there are probably around about 400,000 people in the UK with ME, but that number is probably significantly higher because a lot of people have developed ME following COVID. I mean, ME is basically another post-viral condition. So there's quite a lot of people with long COVID who have either got ME CFS type symptoms, or they've actually got a diagnosis. They meet diagnostic criteria for ME. We don't exactly know how many of those people there are, but there's certainly quite a lot of them. It's an illness that has a wide range of severity, but very important at one end of the spectrum, we have around about 25% of people who are either severe or very severe. That means they're housebound, they're bedbound, they may even be tube fed at the very end of that spectrum. And it's also an illness that affects children and young people. It's one of the commonest causes of long-term sickness, absence from school. And the normal clinical presentation of this illness it's like long COVID. Most of the people are previously fit, young, middle-aged adults. They get an infection. It can be any sort of viral infection or even bacterial infection, and they just don't recover from it. They continue to feel flu-like, ill. They have very debilitating fatigue. It's not tired all the time. It's an activity-induced fatigue. They have something called post-exertional malaise, which if they go to the limits of what they can do, or near the limits of what they can do physically or mentally on one day, then they may well crash the following day as a result. They have what we call cognitive dysfunction. This is the brain fog, which has become apparent in long COVID. This is problems with short-term memory, concentration, attention span, how you process information. They have pain in the nerves, joints, muscles. They have unrefreshing sleep, and they have quite a few other symptoms as well, which can include also problems with how they regulate heart rate and blood pressure. So it's a complex illness involving different body symptoms, a lot of different symptoms, but those are the key symptoms upon which we make a diagnosis.
And part of the problem, Charles,
there's no treatment for this illness at the moment.
I was just going to say, part of the problem with this, Charles, is that for many years it was treated as a psychological condition. I mean, we've moved on from that stage, but that was part of the challenge for people, wasn't it? That has been a major challenge. I was at medical school back in the late 1960s and early 1970s, and this whole illness started off with an outbreak at the Royal Free Hospital in 1955. It got the name Royal Free Disease after that, but later myalgic encephalomyelitis in the Lancet. And when I was at medical school, I was actually on a firm of psychiatrists back in 1970, and they produced a paper in the BMJ which had gone back and looked at these patients in the Royal Free Hospital who were bedbound, and said that this was a case of mass hysteria, and that's what doctors like myself left medical school with. But then we moved on. I have personal experience of this after developing it following chickenpox from one of my patients. But I got involved, and this is what's so sad about the situation in Scotland. I got involved with a leading expert. He was the leading expert at the time, Professor Peter Bean, who was at the Southern General Hospital in Glasgow at the Institute of Neurological Sciences. And Peter and his team were the key people in this illness at the time.
So there was research and clinical expertise there in a hospital setting, which was being passed down to GPs. And I've also been involved with several other clinicians in Scotland over the years. Keith Anderson in Fife, who was a clinical nurse, Daryl Ho-Yen, a virologist up in Inverness, Dr. Gregor Purdy, who was a superb GP in Dumfries, and I helped Gregor prepare the sort of standard guidelines for Scotland on this illness called the Scottish Good Practice Statement many years ago. But this clinical expertise in both community care and hospital care, it's disappeared from Scotland. So there are no hospital-based clinical services for patients with this condition now in Scotland, and that's a scandal.
I'm going to speak in a moment, Charles, to a parent whose daughter has ME. This new plan for England and Wales, what do you think about it, and do we need it here in Scotland?
Well, I've been involved with the preparation of this plan. It's taken us 3 years. It was very well-meaning. It was set up by Sajid Javid, who was Secretary of State for Health 3 years ago. He got involved because he had a niece who was not managed properly with this illness and said, something's got to be done. We've got to get the NICE guidelines, which are very good on diagnosis and management, integrated into community care and hospital-based care. So that's how the plan arrived. And as you say, this is a plan for England. Health is devolved, as you know, to the regions. So as I'm aware that the Scottish Health Department are taking notice of it, but the actions in it do apply to England. But certainly the actions that are there in relation to education, improving the lives of people with MEA CFS and research, they all apply to Scotland. Now you've got Chris Ponting, the University of Edinburgh, doing superb work on the genetics of this illness, but that's a research base. What we need up in Scotland is some clinicians getting involved in this condition and getting. It's good to see the NICE guidelines in May. The Scottish Health Department decided that the NICE guidelines would come into place in Scotland, but you really need to get the NICE guidelines implemented. And the NICE guidelines state very, very clearly that once a patient has been diagnosed in primary care in general practice, preferably at 3 months from the onset of symptoms, they are then referred on to a specialist referral centre. Now, if you haven't got any specialist referral centres in Scotland, that part of the plan just falls through. Charles, so that's what needs doing.
Thank you so much for your time this morning, Charles Shepherd, Honorary Medical Adviser to the ME Association. That's the overview on this. Let's see what it's really like to live with this. Janet Sylvester is a volunteer with ME Action Scotland. She was listening to Charles there. She joins me now. Janet, good morning.
Good morning, Stephen. Can you hear me okay?
Yeah, I can. Thanks for being with us this morning. Janet, your daughter has ME. Charles gave us the kind of overview of symptoms, and the range of symptoms that people can have. What's it like for your daughter?
Yeah, my daughter's had ME since 2012 when she was in her first year at university. As Charles said, she was a very classic ME patient. She was very fit, very active when she got ME. And really the impact it's had on her life has been, I would just say, devastating. It's, sorry.
I know this is difficult. Take your time to tell us. Maybe if we just start with how it began, if you think back to those first days.
Yeah, it started with some sort of virus, and she just gradually became iller and iller, unable to do anything, and she's would be described nowadays as moderately unwell, and most of the time she's had ME, she's been moderately affected, which means she's been unable to work or study. She's mainly housebound, but she has been mainly housebound, but she can get out of the house using a mobility scooter and wheelchair. So unlike many of the people that Charles has described who've got severe ME, she has some independence and she can do things. She's not bedbound. She's, ME has affected her life, but she can do some things. And I think one of the things that Charles described very well is this post-exertional malaise and the debilitating effect it has on people's lives, that she never knows if she does something, whether it's going to create a huge increase in her symptoms and cause her to relapse. In stages when she's not well, something as simple as when she's lying in bed trying to pick up a glass of water is impossible. Things like brushing her teeth or washing her hair can also be very, very hard for her to do without bringing on her symptoms.
What support has she had, apart from you, and what treatment has she had, Janet?
Well, support-wise, she's been very lucky to have personal assistance through the funding from the local council in Edinburgh. So she has people coming in who help her with her washing, cooking, shopping, and so on. Treatment, again, as Charles said, there's no treatment. She's as many people with ME do, she kind of leads her treatment. She does research and comes up with suggestions for the GP of things that might help her, quite often not with her specific ME symptoms, but with other problems that she has with what are called comorbidities, so illnesses that are very often associated with ME. So she has been able to access some drugs. Having said that, the advice that she's got on treating her symptoms, other than the research she's done, has come through her talking to private specialists. There are no NHS specialists in Scotland, and we've been lucky enough to be able to afford for Emma to see private specialists, but many people can't do that.
Are we still failing people with ME in Scotland, and what needs to change, Janet?
Ooh, big question there. We set up MEA Action Scotland, which is a volunteer-led group to campaign for change for people in Scotland in 2018, and I would say very little has changed since then. What we'd like to see is some of the things in the delivery plan. So, for example, we'd like to see a commitment to research strategy and particularly for funding for research into ME and long COVID. Would like to see medical education and specifically mandatory medical education for healthcare professionals. The NICE guideline, as Charles said, has just been officially recognised in Scotland, and it's really, really urgent need to make particularly GPs aware of the guideline and how it affects how they support people with ME. But I think the big thing for us is that there's no what's called a pathway for people diagnosed with ME. There's no specialist, there's no specialist nurses. There has been some improvement in attitudes towards people with ME, and they do face less stigma and disbelief from healthcare professionals. But on a day-to-day level, the basic treatment hasn't changed at all.
How's your daughter today?
I'm sorry?
How's your daughter
How's my daughter today? Well, she lives actually in a flat. She doesn't actually live with us. So I hope she may be listening to this. And she's doing well at the moment. Can I just say what we would like to see is that the government announced funding in the current budget for services for long COVID and ME. 4 months after that funding was announced in April, there's been no confirmation of how it will be spent. People with ME, including those with long COVID, really urgently need help. And we would ask the government to spend the money they've allocated to us and spend it on healthcare education and services for people with ME within each of the health boards. As I say, urgently needed.
Janet, thank you for your time this morning, and best wishes to you and your daughter. Janet Sylvester is a volunteer with ME Action in Scotland. That money that Janet's talking about was included in the Scottish budget for 2025-2026. I've got a statement from our Public Health Minister in Scotland, Jenny Minto, 4.5 million to fund work across the country to support people with ME, long COVID and other similar conditions. We want this money to have maximum impact. We're working closely with health boards across Scotland to allocate it as quickly and effectively as possible. In addition, we funded Action for ME to disseminate an online learning module for health professionals to improve diagnosis and management. Right now we're at 10:53 on a Thursday morning on BBC Radio Scotland.